Okay, I'm gonna go ahead and let everybody in.
Right.
Hello, everyone. Hi, Kristen.
Hi.
Hi, good to see you. Thanks for being here.
Yeah.
Okay, let's see. We'll get started in a couple minutes. Hi, Bill and Monica. Good to see you. Thanks for being on.
Um, there we go.
Okay, so just one more minute here as others trickle in, and we'll go ahead and get started.
Hello, Frankie wanted to say hi as well.
Hi, Frankie. Thanks for being on.
The few people on.
Okay, we'll go ahead and get started. Welcome, everyone. Thank you for being here for our Caring for the Caregiver seminar. Being a caregiver is one of the most both meaningful and challenging roles that you can take on. Whether you're supporting a parent, a partner, or a loved one, this seminar will give you tools to help you feel seen, supported, and better prepared. Hi, everyone. My name is Tori Sierra. I'm a certified financial planner helping clients get to and through retirement. A big event that affects someone's planning for themselves is whether or not they need to care for someone else, whether, again, it be a loved one, a parent, children, adult children, or a spouse. And caring for someone might look like caring for them from a financial standpoint and or a time standpoint. Um, we just let one more person in. Okay, awesome. Um, if it's financially, that impacts how they save for their goals. And if it's with time, it might look like time they're taking off of work or away from hobbies, loved ones, etc., that can help with their planning as well. So this is a very important topic, and considering you're all here, you know that as well already. So let's get moving to the meat of our presentation today. Um, our webinar, this is kind of an outline of our evening together. So just went through our welcome. And then our featured speaker, Mary Winners, will be going through her presentation today, Caring for the Caregiver. And then we'll end with a wrap up and a thank you. Mary is the founder of About Senior Solutions and a gerontologist. Mary has over a decade of experience in healthcare, and while physicians and nurses provide medical recommendations, Mary understands the other side of healthcare, the confusing maze of healthcare options and unknowns. She has extensive knowledge in acute care hospitalization, gero-psychiatric issues, Alzheimer's and dementia care, hospice, assisted living, and other senior care options. A noted speaker and advisor, Mary has provided professional services to a wide variety of seniors in every economic category. Her ability to accurately pinpoint and guide families as they deal with emotional, life-changing events gives Mary unparalleled insights. So, thank you, Mary, for being here, and we look forward to hearing from you today. So, I will transition my screen over
Okay.
and you can take over. Thank you so much for being here.
Oh, absolutely. Thank you so much for having me and really appreciate your thoughtfulness for your clients and the people who are attending. I know this is a really challenging, it can be a challenging topic and a difficult thing to do, even if it's somebody that you love. So let me see here. Um, can you see my screen okay? Does it look like we're projecting here?
It's a little bit smaller. We can see the other slides and like the notes section.
Let's see if we are on the wrong, the wrong section here. Hold on just a second. I'll stop sharing that. Okay,
Okay.
computer screen. But I just also want to remind you or let you know in advance to have a little paper and a pen or pencil because we're going to take a little quiz. We'll see what your level of caregiving savvy is and take a little quiz and see if you think that you're on the mark or if you have some questions from what we put together. So we'll go ahead and be ready for that. And let's see if I can find the right thing here. Here we go. This should be it. All right. Does that look a little bit better? Yep.
Much better.
Starting at the front. We're starting at
Yes.
the middle.
Looks
Okay.
good. Yeah.
There we go.
Perfect.
All right. Now we're ready to go. Um, So we're caring for the caregiver here. And I think it's really important for you to know how important it is to invest in your well-being and how crucial it is to really take the time for yourself and replenish yourself and make sure that you are understanding how important you are as the caregiver, because who will take care of you and who will take care of the person you're caring for if something has happened to you. So we'll go ahead and jump into what a caregiver is. And these are some great resources from the Caregiver Alliance, pretty recent from 2024. And what makes a person a caregiver? Are you a caregiver because you're actually physically providing care? Are you a caregiver because you're paid? What is that? In fact, I think we have a nice smaller group today. So please feel free. Tori and I talked about this ahead of time. Please feel free to raise your hand or ask a question during our presentation here so that you can really have a more detailed response for any of your questions. So what makes up a caregiver? And so I think most people think that because they're not paid or they're not actually physically providing the care for someone, that they're not a caregiver. Obviously, we have the formal caregivers who are paid. They're often through an agency. They can be somebody who's hired privately outside of an agency. I caution anyone who is doing that. It's not that you can't. There are some additional laws in California that you want to be conscious of so that you protect your estate in that issue. But you very well may be a caregiver, even if you're from doing it from a distance or it's a friend. You can very possibly be a caregiver. So some of the statistics that we're looking at, the total number of caregivers in the US is probably up to 55 million people. And people who are cared for that are 50 plus, it's up to 45 million. We have caregivers who are providing care for their children with special needs, and that can be up to 7 million. And a lot of the caregivers, the family caregivers, like 80 to 90% of those people are not being paid, but they are putting a lot of time and effort into providing care for their loved one. And then millennial caregivers, these are probably people your age. They're between 25 and 44, taking care of parents, taking care of grandparents, taking care of a sibling that may have a disability. So you can really see how people can be squeezed in the middle of being a caregiver and their other life. Often anybody in the millennial age bracket is probably going to have a job, probably going to have a sweet little Frankie that they're taking care of and or other children. And they're also trying to manage the support of somebody else that they really care and love. So, 53 million adults providing unpaid care, that's a huge number of people in the workforce that are supporting individuals that they care about. It's also kind of interesting because more than half, 66% of people are about 10 miles away or less from the people that they're caring for. So not as difficult maybe to do, maybe. 13% live a little further, 11 to 25 miles apart. And 21% live more than 26 miles from their loved ones. So they're doing this long distance, or it's taking much more time to get to them if they need something. And so how do you prioritize others? There's 11 million caregivers or sandwich caregivers providing care for children and parents. So you are definitely not alone, but it is an enormous number. So nearly half of all the caregivers experience mental health issues. Most commonly, I see depression, anxiety, kind of people freezing, not knowing what to do or how to do things. And if you've never done this before, how would you expect to know exactly where to go or how to get the resources or where you're going to be most effective in supporting the services for the person that you're caring about? And oftentimes, HR directors or managers, they don't really know that something's going on with you trying to take care of a loved one until they either ask for leave, family leave, or your work performance has been so poor they want to fire you. So 1 in 5 caregivers take a leave from work. We're not really quite sure what happens with others. Um, Sometimes it's not a great situation when they haven't shared some of those things and maybe they don't want to. But it can definitely put your monetary position in a lot of risk also as a caregiver. So up to 40% of caregivers actually pass before their loved ones. And this is something that I unfortunately see quite often. It is a situation where, in particular, spouses, one will care for the other, and they do not think about the extra support that they might need. They don't replenish themselves. They become overwhelmed. They neglect their own health. And I often see that it may be a major incident where they have a stroke or a heart attack or another neglected healthcare need. They wind up in the hospital, and that's when the adult children may come in and say, I didn't realize that mom was so bad and dad was burdening so much of her care. Why didn't he tell us? But that is usually when we know how bad it is in a household situation. So here's where you need your pen and your pencil, or your paper and your pen, and we're going to take a little quiz. So your answers are going to be between 1 and 5, and 5 is you strongly agree. 4 is you somewhat agree. You're neutral if you respond 3. Somewhat agree is 2 points, and strongly disagree is 1 point. So we're going to go through these questions. There's a total of 8. Keep track of your points, and then we're going to see where you fall in the caregiver IQ. So number 1, I am confident when it comes to managing issues with healthcare concerns for my family. Is that 5, 4, 3, 2, or 1? We'll go on to number 2. I have a good understanding for the cost of care. So do you know what is covered under insurance? Do you know what is not covered under insurance? Do you know how long it's covered under insurance? Do you know if you don't have to pay for, or if you do have to pay for it, what is it going to cost? What kinds of services are provided in assisted living versus skilled nursing facilities? What do you feel like you have? Do you feel like you have a good foundation and understanding? Go ahead and put your score in. So 3, I am educated when it comes to managing the healthcare journey of my family member. Have you taken courses on care management? Are you experienced because everybody's leaned on you? So you've taken care of mom and dad and your in-laws and maybe a few aunties. So put your score in there, 1 through 5. And then four, it's really kind of a two-part, but I feel I have sufficient knowledge about care options and utilizing insurance, and I'm very involved in the management of the care for a family member. So where are you on that range? And then we'll go on to our second set of questions. Same thing, 5 to 1 score that you'll award yourself. And number 5, I am clear about family members' goals for care and our plans to accomplish them. Do you know what direction you're going to take? What is your path? 6, I am highly responsible and take initiative when it comes to care issues for a family member. It's kind of a tough one. You could be very responsible. Sometimes it's hard to know where to go, too. Number 7, I like to collaborate with my siblings, provided you have them, and or well parent in making care decisions for that individual that you're going to be caring for. And then 8, it is very important to me that I always have a complete understanding of my family member's care situation. Do you know if they're telling you everything? Do you know what they're taking as far as medications, what their healthcare conditions are? How much did you know about dad shouldering the burden? How much are you shouldering the burden and sharing and asking for help from others? So go ahead and add your score up. I'll give you a minute here and we'll go on to see what the results are. Tori, do you have any questions about this or any comments in between while people are scoring their
Yeah, I mean, I'm not currently a caregiver except for my daughter
of
Frankie.
course, and you know how much time it takes, right?
Yeah. But I did answer these questions, and I am alarmed at some of the kind of lower scores that I gave myself. So I feel like my caregiver IQ is kind of low for sure.
All right, that's interesting. Well, we'll see
Which is
how
okay, right? It's a neutral kind of number,
abs
but kind of
abs
like where we're going from here, right?
Sure, sure. The whole idea is to improve too, right? And to
Right.
to improve our caregiver IQ, to improve the support that we get, to go to our trusted advisors such as yourself, so that we
Yeah.
know when you need something, you're ready with, this is what we've planned and this is what we're able to do and this is what we can roll out with you. So this is perfect thing to be working on now for the future. So let's go
Right.
ahead and we'll jump into what those results could be. Oops,
Bill
let's
and
see.
Monica, did you have a comment?
We're at 22 out of 40.
Oh,
Okay. So
you
here
did
you
it
go.
jointly?
Pardon?
You did it jointly?
We did it jointly. Yeah.
Yes.
That's
Mm.
great.
That's why we're here.
Okay, that's great. You know what? This is wonderful. I'm so glad you are. And when Tori mentioned how many people are coming, I said, this is so exciting. It's wonderful because that means everyone who's attending really is curious and they need this information. So I'm so glad you're here. So if you put your score together and you have a 35 to a 40, you are a starter, meaning you like to start in things and move forward and fast, and you have a lot moving in the direction of being a caregiver. If you are that 22 or 20 between 20 and 26, you're a team player. You are probably working with people like Tori and maybe your financial planner and other people, and you're getting to that point where you are understanding more and you're learning and you like to collaborate with others too. 27 to 34. Oh, let's see, we've got this out of order maybe. That is a thinker. And a thinker thinks a lot about what they want to do, but they don't always execute it in a very timely manner. And then you have an ostrich, 14 to 19. And really, I mean, you might not be thinking about what you need to do and think that this will never happen. And maybe it won't, but that means that there'll be something very sudden and fast that changes versus something that happens over a longer period of time where somebody needs support or care. And then we have our individuals who I call a stargazer. They rated somewhere between a 8 and 13, and even beyond being an ostrich, they truly do not think that there could be anything that may happen in the future where they would need these types of services or support. And more than likely, I find that most people who are in those two lower ranges or scores, they've not experienced this with a parent or a loved one. So they have nothing to gauge this on or understand why it's important for themselves to have something more. So if you did get these scores, look at where you fall. The starter, like I mentioned already, you're a trailblazer and you've got your plan going. The team player really does work well and collaborates, but you do second guess yourself a lot too. So lean on Tori, lean on your trusted advisors and the people who are closest to you in your circle to get that plan organized. I remember when um, my kids were younger and still minors, and my dad really wanted me to put an estate plan together and was encouraging me to do that. And I said, I can't move forward because I feel like I don't know who would take our children if something happened to us. And he said, Mary, just start somewhere. When you start the ball rolling, you'll be able to add some of those other items that are a little more challenging for you to think through later on because you don't need to have all the answers today. So I really appreciated that advice, and he was absolutely right. One thing led to another, led to another, led to a complete plan. I was so grateful to have that because it was necessary for me to step in and make some healthcare decisions for my husband a few years later.
Mm.
Thinkers, you want to make it perfect and gather the resources and create that plan. We're going to be changing things over time. We have things where we have more children to add to our family. So we have our estate plan needs to change that way. We have divorces, we have marriages, we have all kinds of wonderful life events, which will change our plan pretty, like maybe every 5 years or so to review. So don't worry about the perfection as much as getting the plan done. I have a client right now. She does have some cognitive deficits, and she's had a very difficult time um, kind of letting somebody else eventually be in charge. And because she's so adverse to that, she will not put a plan together at all. So she has zero, zippo, nothing. And we will have to go to court to get the support that she might eventually need if she's not capable or willing to put some planning in place for herself. And the ostrich actually they probably will launch a plan, but it's still really hard. And maybe it might even be hard for them to accept the input. The stargazers, you just have never been through it before, and you just really don't think it's going to be a problem.
Mary, just to clarify, the team player number was that was between 30 or 27 and 33, right?
I think that was the 22 to 26. We could go back. Let's see. Oh, team player 20 to 26. Oh, I've got two that are there.
That's an order, right? Like it's
Yeah,
high
yeah.
from
So going back, I figured I might do that. So going back, we've got the thinker has the higher score. The team players, the 20 to 26. But don't worry, whatever score you got, we'll be improving that. And that's why Tori's here too. So, do you have any elephants in the room taking up space? We often have those situations where we know we need to make some change, or we know this isn't right, or this isn't working. But sometimes it either doesn't hurt enough to make the change, we don't have the time to make things set up to create that change, or we don't understand the value of creating that change for ourselves. But oftentimes there's some kind of presence that's taking over and sucking up some concern that we might have here. So I don't know how many of you have an estate plan, but that is the first place you want to start. That is extremely important. You're also putting together your financial planning. So what are the items in your life that you want to plan for? You would definitely plan for a wedding, you would plan for a vacation, and you're certainly not going to walk out the door to go to a brand new restaurant or hotel or a friend's house that you've never been to without having a plan or having the directions to get there. So I created an acronym several years ago where thinking ahead is really a gift to yourself and to the people who are going to be left with the pieces to help you with your support. So I want you to understand the magnitude of what your situation might be. You might be very healthy and everything's moving really smoothly. You may have a diagnosis of some kind. You may be in an age bracket where naturally there might be some more concerns. I tell my clients all the time and practice asking. And I tell them to ask and ask again for help. Get yourself used to asking for little things for help. When somebody offers little things like, can I help you to your car with groceries? Maybe you want to say yes. Start saying yes here and there so you're used to saying yes. We as a society do not like to say yes to people helping us. So get used to putting your asking cap on and or saying yes to some potential help. So if Tori wants to help you more with some of your planning that you're providing, you might want to consider saying yes to that. Planning really is a gift for you and your loved ones. And I think the thing that's really interesting is it makes people feel really good to know that if my plan was to do X and I'm providing or I'm taking the steps for that plan for my loved one, wow, I'm doing exactly what they want. So how great is it that if you're planning in advance, you're supporting the person with exactly what their plan is. So putting it in place and then being able to execute what that person wants is such a valuable, heartfelt tool to make everybody feel good in a really challenging process. And then one of the other things I see quite a bit is till death do us part. It doesn't mean you do this alone. We have so many wonderful couples who have been married 10, 20, 50, 60 years. And when we took that vow of marriage or to stay in a partnership forever, it doesn't mean we don't ask for help still. It doesn't mean we can't do it with somebody else's support. So please, please just know that you're that couple and you have that vow that you've created for each other, but it still means that you can ask for the help to make sure that you really take care of yourself and the person you love. So what GIFT stands for is it's the acronym for gather all the information that you want for your plan, inform the people that are going to be part of your plan, and that includes professionals such as your attorney and Tori, your financial planner. And then you want to follow up on those plans. If there are documents that you need to secure and sign and complete, you need to sign them and make sure that they are all, your I's are dotted and your T's are crossed. We have quite a few scenarios where we have people that do not follow up on these things, or they do not inform their decision makers that the estate plan is with a particular person or in a particular file, or the attorney who at least created that estate plan for them. So when that happens, we don't even know that they have an estate plan. And then you want to tell everybody what you have, what your wishes are. So if you don't want to burden your child, your adult child, say, about what your wishes are, who are you going to tell? Do you have someone like a care manager? Do you have a best friend that you can save a file for, or at least tell your decision maker, I have this red file in the left side of my desk, and when and if something happens, I want you to go to that file. and I don't want this and I do want that. It's so helpful. There are difficult situations, but I'm telling you, when we have conversations with some of our families, especially if you're kind of in the mix of things at the hospital, I like to kind of calm people down and say, we're going to get through this. We're looking at 10, 15 years down the road, and something might happen. What is it that you would want? And it kind of calms people down a little bit, makes them feel a little removed from an urgent issue. And we can kind of calm our minds down a little bit and make some really valuable decisions. So I like to find that happy place for people when we plan. This is actually something that I use in court scenarios quite a bit, to evaluate and look at the plan as far as what we can do moving forward. You can use this as a planning tool early on, but we want to get you to as happy of a position as possible in your planning. So the circle with the arrow around the diagram represents how things change over time. So when we're in our 20s and so forth, we're not going to have the same issues for care or long-term services necessarily, but maybe you break your arm. And so what are the tools? What are the things that you might need to do or pay for if something like that happens? And then time continues to go on and you heal and you're back to a situation where you're at your regular baseline, we call it. And you may be in a situation where you're in your 80s and you may have been diagnosed with a condition that is irreversible, but manageable over time. So what do you want? What are your wishes? Do you want to stay at home? Would you rather move closer to a family member? Or would you consider a senior community? What will keep you safe? What kinds of tools will you need? What kind of maybe direct care would you need? And what are your finances? What is the financial situation that you've worked out over this longer period of time with your financial advisor? And so when we marry those three items together, we're able to see what steps we need to take and what resources we need to or can use to create your plan. That might be adjusted over time as well, because maybe you want to stay at home for a certain period of time, and shift to a different location. Maybe we can see that you can afford something for 10 years. Maybe we see that it's a situation where, as a couple, you might want to move to what they call a CCRC, a continuing residential care community. Those are locations, if you live in the San Gabriel Valley, you may be familiar with Montecedro, Villa Gardens, Royal Oaks. They are communities where you can go in independently, add additional care to the services that you're getting, that would eventually turn into assisted care. They have memory care, and some have skilled nursing facilities. So I don't know how many of you are using kind of a team concept. You wouldn't be here if you didn't appreciate expertise. And so you're using the expertise of your financial advisor and the tools that she is bringing to you. But how many times have you planned for long-term care for yourself, as far as the actual care, the actual resources, the steps that you might need, how to utilize insurance? Do you become overwhelmed and frozen when you're in these situations? We hear the fight, flight, or freeze kinds of scenarios. Where are you in that? Are you losing yourself as a caregiver? Can you be objective? Sometimes I see that it's really hard for people to communicate with memory loss because it's frustrating. I've told you 15 times. It can really wear on our patients too. Who needs to be in your team? Think right now about who needs to be on your team. What kind of skills, what kinds of expertise? Do you need to have family and friends? We put together Team Joe, say, and so that might be professional individuals with more expertise at the planning level. but then you might need people who are going to execute some of that care, provide the care. Maybe I had a situation with a lovely lady at 96 was living alone. She did have some memory loss. She had wonderful neighbors who would watch her blind go up and down in the evening. When she got up, the blind went back up. She did not want caregivers in the house, and we were trying to respect that and still keep her safe. So we put sensors in her home, which she agreed to, and very non-invasive, no cameras. And the thing that was so great about it was we knew that she, after a couple of weeks, it picks up some patterns in how you spend your day. And we had people who were visiting her every day to do her hair one day, do bridge one day, go to the market one day. So there was lots of interaction in her home. And then we knew she was also stable and moving in her house. So it was a great way to put a team together with the neighbors watching and having individuals who were part of her team. And then if we needed to add more care, we'll add more care to her situation. But we can look at your team as an individual situation and who you want to have part of that team. And then what are your biggest concerns? We can only bite one bite of the apple. Going back to the elephant, it's a huge elephant in the room. So what are we going to address first? And how do we organize the most important thing and get through that step into the next step and the next step? So some of the experts you might want to consider to be part of your plan is your financial planner. I didn't put attorney unless they're on the next slide, but financial planner, your physician, they know they'll have more understanding of your life expectancy and the medications that you might want to take or change, what the natural decline is. A good geriatric care manager will understand that as well. But they have a different and kind of unique understanding of the overall system, resources, and how to advocate through those systems. And I find that even though doctors can be wonderful and know some components of that, they truly don't have, that's not their job. That their job is to know what your disease is and how to work through that issue. It's not to know what all the facilities are like and when Medicare is going to cut off. So having this additional team member as part of your planning can be really helpful. And then, are you willing to nurture yourself? Can we look at advancing the plan and creating a plan with experts? And you really use people as much as or as little as you need them. So it's really up to you to decide how much time you may put into your plan or how much detail you want to put into that plan. What kind of support groups can you be part of? If you're living in the Pasadena area, there's something called the Pasadena Village, a really wonderful group of independent seniors who have multiple support groups, activity groups, topics of interest, get-togethers, really amazing things in the communities that you can really take advantage of and bring your loved one who may need that extra support too. So it's a kind of a win-win. Are you open to the help or are you really closed off? How are you managing your stress? What's happening to your body? And are you seeking your own regular care? And if your hair's falling out, are you checking into why that's happening and fixing those issues? There's so many things that can happen with stress, as you know. And we want to make sure that you're really open to getting that help. I call this um, not letting your butt get in the way. And that may sound silly. It's actually a conjunction, BUT. But when I hear families, when we discuss solutions and they say, but I can't because, but I can't because, but she won't, and I can't, I realize that you can't continue to say that and be open to a suggestion that might help you. So think about how you're languaging and responding to people who are professionals who are offering help, because there can be plenty of non-professionals who like to offer all kinds of support and ideas, and that might not be the right solution for you too. And then look to your community, your family, and your caregiver support centers. There's day care centers. There are Alzheimer's support groups, Parkinson's support groups, so many wonderful services and support in our communities. And then what are you doing to regularly refresh yourself? Focus on your energy. Are you taking a nap when your loved one might be resting? This is something actually that a very wise nurse shared with me when I had my first son, and I use this with all of my clients. If you only fit, say, 5 things in a day or 10 things in a day, you're still only going to fit 10 things in a day as a caregiver. And so what are you going to decide to give up? Because you're still only going to fit those 10 things in there. And are you fitting your support, your care, your extra phone contact with a friend, or a walk, or a cup of tea, or a nice coffee in the morning with maybe a meditation for yourself? What are you doing for yourself to maintain your energy level and your wellness? And remember, we can only do one thing at a time. So when you start feeling that anxiety and overwhelm, I've got to do this, and this. Listen to your voice. Are you getting higher pitched as you're speaking even? Slow down, write it all down. Think about what's the most important thing on the top of your list and then prioritize it. And you might even want to ask for help on those items that you put together on a list. Maybe groceries can be delivered. Maybe somebody's willing to pick up the pharmacy items and drop them to you. Ask for help. Look at what is working. So often it's so easy to say, this is not working, it's horrible, and nothing is working at all, and I hate this. And just stop and take a deep breath and find one little thing that might be working at least. And then, I kid you not, please schedule time for yourself. It's so important. And if you're not doing it and acknowledging or making sure that you're doing this, it just won't happen. It's like anything else. We don't go on vacations if we don't plan them. We don't um, we don't get out the door on time unless we plan on leaving at a certain time. So make sure you're scheduling these little opportunities for yourself to be replenished. So you know when you're burned out, when you're exhausted and you're withdrawing from everyone. You're not going to the normal things you would attend. You're canceling parties with your family or Sunday get-togethers with your family. Your own health is changing. You see a change in yourself, but you're denying it. And then I think there's something that's really challenging as a caregiver too. You can have a lot of guilt about I'm not with them enough, or I'm not doing the right thing, or they're really not that bad. I can take care of it. I think I got this handled. So there's a lot of bargaining that we do with guilt and with fear. So stop yourself and ask yourself, just like the but I can't. Are you closing yourself off to support? Are you closing yourself off to being present with others? Just think about how you're engaging and what kinds of what your life might have been before you were a caregiver and the things you were involved in and what you're doing now. What things have changed? If those 10 things fit in your day, what have you eliminated that was really helpful? Something you enjoyed, something that you really need to get back to. And there are a lot of things that we're using now. Every day it feels like there's some kind of technological innovation that's come out, but we've got some really wonderful companies. As I mentioned, we have sensors that we can establish in home. I have a few couples where interestingly enough, it's the husband is the well spouse and the wife is having some health issues or dementia. And so what happens if something sudden happened to the well spouse? If we stop seeing activity in the household, um, if the person who's sick, they can't pick up the phone and call 911 or ask for some support because something's happened to you, then how is someone going to know that you need help? My mom is living on her own, and she said, "What do I do? How will you kids even know that I'm, down on the floor?" And so we set the sensors up for her so that she feels confident. We see her leave in the morning, take a little walk with her dog, and come back. Um, it's been a really nice thing. I had her Wi-Fi went out for a little bit. And so I was alerted and I figured it might be something like that, but I just texted her quickly to make sure that she was able to respond. And she's responded back with, yes, have a great day. I love you. And so I knew everything was fine. Um, are you using things like home health? Those are items that are covered under Medicare. Home care is not, unless you may have some time that's offered in your healthcare policy. In their day programs, sometimes those are covered under insurance, sometimes not, but they can be very cost effective as well. Are you using a life enhancement program, an activities program where somebody can come to the house and provide an activity specialized for that individual? Are you using care management? Do you have a plan? Do you have somebody who's put a plan together for you? Have you decided to implement it on your own? Are you asking for assistance to get that plan worked through? There's some really, really great resources that can really take you leaps and bounds beyond what you would do on your own. So the value of expertise, you see this sunny little picture, kind of through the tunnel here. So we see the light at the end of the tunnel. And if you are using the support groups and counseling, there's some great counseling available under Medicare too. There's all kinds of support groups who offer free training, things like body semantics when you're showering somebody or helping them, or training on difficult behavior because your loved one doesn't want to take a shower. Tips for the caregiver just to manage stress and get additional help. And then there's Pasadena area in particular is just filled with enormous organizations that offer a lot of support. With the fires and so forth too, there are a lot of additional resources through the county. The Altadena Senior Center burned, which some of you may be aware of. It's functioning again, and the Pasadena Senior Center has been offering a lot of support in that transition. But that is for families as well as the individuals who need the direct help. And then just to recap, are you prioritizing yourself? Do you not feel guilty about taking care of yourself because you need to be there for that other person? Ask for help. Who is part of your team? And what is your plan? What are your wishes? Have you thought about what you want, what you don't want? Are you familiar with things, or do you know what you can do to create a safer environment in your own home? And have you worked with your financial planner to really set you up with an understanding of your finances and what you can provide for yourself with that plan that you put together? So thank you very much. If you have any questions, you've all been very good and rather quiet. So I'd be happy to respond to any questions that anybody has at this point.
Uh, how would you find a geriatric care manager?
Um, well, our office has 5.
All right, there you go.
Yeah. Yeah. So at About Senior Solutions, Tori could connect you with our office, or is it okay to leave our phone number, Tori? Or
Yes.
okay, our office number is 359-626
Uh-huh.
359-0108.
Okay, great. Thank you.
Yeah.
Yes, I can also, if it's okay with you, Mary, send out in a follow-up email with the presentation and the link to the YouTube recording, your contact information. So if anybody has extra questions that they have that's specific to their situation, they can go deeper with you if they need to.
Sure. So you could see why it's really important to work with Tori long term and look at the changes that you might have in your plan and make sure that you have all your experts on your team.
Yes. And one thing I will add too, Mary, I have a really great Medicare specialist who looks at clients, those who are on Medicare, looks at their policies every year just to make sure that they have the right, coverage that covers all of their pharmaceuticals, the specific care that they need because it changes every year, right? Would you add that to a list of professionals that would help during the care season?
Absolutely. It's great, especially if we've had a change in condition, meaning, is there a new health issue that's popped up? Are you on a different medication? Do you have a different kind of provider? Have you moved out of the area? So I like to work backwards when you are looking for um, uh, to change potentially your insurance. Will your doctor, if you have a favorite doctor that you really want to continue working with, will that doctor take your insurance? So that's usually where I start. And then the professional can really work through all the details and some of the extras. Do you want a Medicare Advantage plan? Do you
Right.
want regular Medicare with additional plans that cover your hospitalizations and the overage of what your primary Medicare won't cover? So a Medigap program is what, or insurance is what they would call it. So, and then you've got your drug, but if you have your Medicare Advantage, it would be all of those all together. But just be aware. Sometimes it doesn't cover enough of what you might need, and just talk with Tori about your overall plan and what that expense is, because sometimes going into the traditional plans with all the extra Medigap and so forth is challenging to pay for some. So just go through your cost scenario and see what works best for you. I can see William has his hand up too.
Thank you. Yeah, my question is what your assessment is of long-term care insurance plans.
Sure. So I think it really depends on the details of the plan. My experience is that they don't like to give up easy when it's time to surrender or start providing the services under that plan. But they do. And they've been a godsend for quite a few of our clients. I think people wait too long sometimes before they activate a plan. So I think that's also another important piece to talk with your financial planner about and start that in a timely manner. We can be conservative as far as can we use sensors and that sort of thing and reduce the amount of care or not. What's the overall benefit or support that you're getting? Is it something that has an investment piece in it where the money may come back to you at the end? What's the length of time and the monthly amount output? It's very expensive for care, and it's just going to get more expensive. I have long-term care insurance for myself. Um, I think the only time it really doesn't come in there, and there are people that do not agree with me, but I think the only time that it doesn't come in to support somebody is if they pass suddenly and they
Yeah.
don't have an opportunity to use it. But I will say that the majority of people, probably 85% of people have long-term declining illnesses. And I find that it's been extremely helpful for people. I have somebody right now with a policy that's covering her for $14,000 a month for her life, which doesn't even exist anymore.
Impactful. Yeah.
And it is impactful, and she's getting great care. And I think, I think what people do sometimes is they think it's a candle that they shouldn't burn because it's special. And you want to use it when it's when you need it from the start. And don't just push it to the side. The other thing that's great about activating your long-term care insurance is you don't pay the premium anymore.
Uh-huh.
Interesting.
So it's, you finally start getting the reward that you've been paying into. And then depending on the type of insurance also, sometimes you might just need it for a short time. Maybe you have a hip replacement and you need care. So it might just be a short period of time. And sometimes those policies will replenish as you go back into paying a premium. So those are things that can you activate, deactivate, activate. Those are nice features too to look at.
Yeah, Bill,
Thank you.
Alex
Yep.
can help, and Monica, Alex can help run some quotes for you if you want to look at traditional long-term care. Like Mary said, it may or may not make sense for you if it might make sense for you if you want to just cover the risk and are okay with potentially not using it. Like Mary
Yeah.
said, if you do pass away right away, you're not going to use it. So sometimes there are other, alternatives that you can use, like a life insurance policy, or which will create a tax-free death benefit that maybe your caregiver or your heirs can use to pay the care bills back, or maybe there's like a long-term care rider that you can qualify for once you're unable to do 2 out of 6 activities of daily living to qualify for that. Accelerated tax-free benefit that would pay out monthly. So there are a lot of options. I know you're working with Alex. He can help you run some of those quotes to see if it even makes sense. Or
Yeah.
you might also be self-insured too. So he can kind of stress test your plan to see, like, if you were to need care, let's say
Yeah.
$10,000 a month for 3 years, how would that impact, the the living spouse after you go through your assets for 3 years,
Mhm.
um, or not? Like it might not be super impactful if you are self-insured.
Well,
So,
we have had it since our 40s.
Oh,
oh,
great.
So
okay,
I was asking just to get your assessment
I
if we
see.
made the right decision or not.
Mm,
It sounds like we did.
Yeah, you've been paying into it, I'm sure, for a while, and obviously
Yeah.
Tori can run the numbers on that too. And then in regards to the life insurance too, Tori, that's a great point, like using life insurance for some of this as well. And there are people who have I guess it's called a life settlement. You can sell your life insurance and
yes.
certain types of life insurance policies.
Yeah.
And you could probably explain that tool better, but that's also a really great option to
Yes, a
use.
viable settlement where you no longer pay the premium, someone buys the policy from you, so they'll get paid out if you pass away, but you get kind of front-loaded the tax-free death benefit, having sold the policy, so you can use it to pay for care in a tax-free way as well.
Yeah.
Yeah, a lot of different options. So this right here is just the asset map that we're able to put together for you. Like Mary said, it's really important to just be organized for yourself and then also for a future caregiver, just to make it a nice gift for them, to make sure that everything is kind of taken care of, your I's are dotted, your T's are crossed. But these are the different kind of planning areas that we can help with. So there's long-term care here on the top. There's, the life insurance policy, the different retirement income streams, um, the living trust. That's also important that Mary mentioned too, making sure you have powers of attorney. So if you become incapacitated, who legally has control of your money and who legally has control over your healthcare decisions. If you're unable to make your own decisions, that's super, super important. My uncle just asked me to be their executor on their trust, and that was really recent, but I realized that they actually haven't gone through specifically what they want. So I just texted them saying, hey, we need to schedule a virtual meeting to just go through everything that you want to happen. And that will be all laid out in a trust. So having a trust is a nice gift as well. And then, of course, long-term care, life insurance, organizing and creating different streams of income to make sure that you can see if, or you're planning on paying for care or not in the future. And then also, I think really important is managing market risk. So if you have created this already with your advisor, the next time that you review with us, one of us, you can review your asset map and make any changes to it if needed. Can also stress test your plan. If you don't have one yet, you can scan the QR code and it's about a 5 to 10 minute questionnaire, and then you can review it with an advisor too. But thank you so much. We're just at the 1 hour mark. So thank you so much, everyone, for showing up here today. Caring for the caregiver is also obviously very, very, very important. So thank you also to Mary for your expertise and your insight on how we can best care for the caregiver today too. So thank you so much.
Thank you.
Thank you. Good night.
Thank you.
Good night.
Bye. Good night.